you're gonna want to find is about T12 to L5, L1, which is usually right about there. So just looking, we can see we have bilateral elevation here. So we definitely have some levator and some trap. I would say trap is a little bit worse, obviously, on the left side. So usually what I will do is I will put my thumbs on the superior angle and then the acromion respectively, just to check their elevation. Elevate this side forward, elevate. There you go. So you'll see something like that, so you can just compare and you can relax. Now for MFR, you get to really kind of have some fun with this. This is our trap. Do you care if I draw on you?
I don't know.
Cool.
I finished it on the board.
Oh yeah, we got straight comes out a lot easier.
Use a blue one.
Right.
Specific.
Yeah, they're real cheap. You gotta
Spin it.
Yeah.
Okay. So, first off, this face cradle is
I've been having some trouble with it, honestly. I've been trying to fix it.
oh, so it's two. So you gotta undo the first one.
Oh,
Right. And lift yours. Lift.
Sounds like you gotta wrap up your ice cream.
Is that comfortable for you?
Yes.
Okay. So we're gonna draw this real fast. Finger from the acromion. Superior angle. Well, they are cheap.
I use a lot better mascara.
I bet you do.
I don't know who did.
Okay, then we come up to here. We got a little spine. Okay, so.
Brooke, you're not doing anything fun tonight, are you?
Huh?
You're not doing anything fun tonight, are you?
No, because I went out last night and I still had some eyeliner on my bed.
Okay.
Oops, that was my fault. I was looking in the mirror. I'm sorry.
What is this? Is this a room?
So, when we're thinking about MFR, this is probably, we'll see how this goes. When we're thinking about an MFR, we got our scapula here, we got our spine right here, we got our superior angle right here, we've got our acromion out here. Okay, there should be a little line right here. Oop, there you go. These, I might have ruined your sheets, I'm sorry.
It's the skulls, they're fine.
Okay, so you gotta have a little bit of fun with this. So we've got multiple different angles coming in through here, right? So you wanna make sure we stretch in those multiple angles in certain directions. So whenever we are attempting to do MFR, I want you to think of inferior spreading away from the spine, torquing works really good, and then rolling, we are actually just going to kind of use these lines to go all the way down, okay? So for the first one, really easy, just get your hands good and warm, place them staggered, and you are then going to lunge forward.
I think you're gonna regret doing that.
What?
Yeah.
It's fine, I don't care, I have nothing to lose.
Are both of your hands stretching this direction? Like,
Yes.
Are you stretching up here? as
Yes, I
well?
am. So the whole goal,
Okay.
again, this is reinforcing movement we want it to do, which is
Right.
down and back, right? So this is coming down like so. This is further
Yeah.
depressing in that angle. Not depressing, sad, depressing as in inferior. And then you would hold that for a minute. And then you can relax. That's just a great one to get off the start because you can go ahead and get a lot of redness already just from that down through there. You can step down if you need to a little bit and repeat that process again to make sure you get the entirety of this inferior angle right here. Are you ticklish at all? Okay, good. So then you would hold there. And those are just two really good stretches. Now, because this is you are not lying, because this is a large area, the other things that you can focus on are cross arm stretches, one hand on either side of the intrascapular space. If that feels weird or if the position isn't right, just go ahead and stagger yourself, come across the body. Now, the other one that I really, really like is torquing. So these are all coming from a superior to an oblique angle. These are perpendicular until about the mid, and they transition down. So because of that, we're gonna torque both ways. So think of torquing, just interlace your hands, whichever one you want on the bottom, put that one there. So we're gonna start like this, and I'm gonna kind of hold on each side, the medial angle in this top portion where the spine is, to just give you an idea. And also you can see I'm starting perpendicular to the body because when I torque, I'm then gonna end straight with my forearms. Okay, so that way you're not looking like a doofus trying to stretch like this, completely collapsing your glenohumeral joint. So you got to think about that. Okay, so bring it straight in here, and then to repeat that, you would alleviate, go back the opposite direction, and torque right back to center again.
So it doesn't matter which bottom hand you use.
No, just whatever is most
Rotating
comfortable
back,
for you.
wouldn't
Yeah.
do it.
The idea is if you need to go to the right, if you're trying to
Where
torque
you
to the right,
start.
you need to start to the left, and vice versa. Okay, so then we've already got a good little bit of hyperemia through all of our blue. Now, you can take the time to treat the entire scapula for this today just because of time. I would say don't.
Can I see how you do your hand?
Torquing, just like that. Yep. Either way. Interlacing those thumbs just helps kind of stabilize me a little bit. That's why I like it. Now for the rolling, what we are going to focus on is multiple different directions. Okay, so I like to pull a hair out of the way so I can make sure we can access all this in the front because we know that it comes forward to right about here for this first lateral third portion of the clavicle. So to roll, we're going to go down the borders. So I usually will start right on the medial border so that I get, it's even sparkly. So that I get on both the medial border and over top of some of the posterior rotator cuff muscles. I'm gonna use a wide grip. And we're gonna lift that skin away and roll to the inferior angle. And then we're gonna shift our direction towards the spine with the muscle tissue. And then you're gonna slow down because I'm losing the trap portion here, coaxing that through, and then you can stop. And you're gonna repeat that, and your angle will gradually decrease in intensity as you go to a straight line. And then lastly, we'll do one right through the middle.
If you couldn't get your client to a point where you could do this with them, you'd do MFR stretching, but would you just do a lot of it and then still treat without skin rolling?
Do
or-
a lot of it. You should be able to get the majority of people to roll, but if you can't, again, just like any other area, just double down on the stretching until you can.
Okay.
There are obviously some other techniques where you can go cross body and stretch this way, just to help loosen that up. But with the torquing and the inferior angle, you're usually going to get some lift to actually come up. So you would repeat this. Usually if I'm doing skin rolling, I'm doing this for about 2 to 3 minutes, just in these lines alone.
Mm-hmm.
Now, I think in here it notes, the entirety of the scapula. We'll cover the majority of this on rotator cuff day because you can go crossbody.
Is all of your skin rolling medial of the scapula?
Yes. Now, from the spine though, we can go all the way across. If you lift at that spine, pull that skin away, you can travel across the spine of the scapula towards the acromion. And you can repeat that all the way down and across, shifting your angle to go with the lateral border of the scapula. All the way down. Okay, so those are just some good inferior perpendicular angles that you can roll. Ooh. Here's a necklace on the floor. So those are some good couple ways just to begin the MFR. Make sure to hit this whole trapezius because we've already got quite a bit of little hyperemia developing just from our rolls there. And then I'm gonna sit this on your bump, okay? Then, before I go into step number 2, we're gonna talk about this inferior angle. So when we talk about scapular dyskinesia, what you end up having, 2 of the most common signs are a hyperactive dyskinesia, meaning dysfunction of the scapular muscles. So it's a motor dysfunction. 2 of the most leading things are a hyperactive upper trap and an inactive lower trap and serratus anterior. We'll get to serratus later. So if you're attempting to do trigger points because you feel like there are trigger points in here, then that is when you're going to do the elevation of the trap to pinch or compress it. If not, then don't worry about the elevating, the lifting, and the compression of the trap, which I think is step number 5. Let's see. Number 5. So using opposing fingers or thumbs. So you can do this a couple ways. You can come in with index and ring, and you are going to pinch or kind of curl into the rib cage, travel medially until you feel that scapula. You can actually flip over it, if you watch here.
Scapular, you mean?
I mean trapezius, thank you. Doop. Flipping over it, doop, doop, right? So you would curl in, go underneath, pinch towards one another to elevate this head, because this gives the sense that you're treating the trap, and you actually will feel it slip. Watch right here. Boop, I just lost it. Okay? If that's not working, you can use opposing thumbs. We're coming towards one another, starting immediately lateral to the spine, immediately lateral to the lower head of the trap, going directly towards one another to pinch or compress it together. This feels much more superficial as compared to deep compression through these muscles, okay? Because that is targeting deeper layers. Not to say you shouldn't do it. I'm just saying if that is your goal, you need to pinch or compress and lift that up if you've identified the trigger point in this lower head. Can't do that if you have lotion in your hands. If you put lotion on this structure, this thing is gonna slip all over the place. So do that dry, okay? I would do it immediately after MFR. If you're trying to get this to activate, we're gonna use depotement to actually get it to depress the scapula. We'll get into that later. So I'm gonna go right into step number 2, which is the gliding pincer grip. This is the money move for traps. So I'm gonna come back down to this angle here. I need to go a little bit lower. All right. So we're gonna come down into this angle, and the whole goal that we're gonna start with is at this inferior angle and of the neck, draw this down and back while you hook into the supraspinatus fossa. Because this is gonna help you cheat a little bit later to go ahead and get supraspinatus ready to work when we get the rotator cuff. Okay? So then we're just gonna repeat this first, just apply our lotion. Make sure we get Brooke looking like a Smurf. And then the gliding pincer grip, you can do a couple of ways. You can come underneath with your superior hand to elevate the scapula, or not this, I keep on saying scapula, the trapezius. Elevate that up. Then with this hand, crawl along and trace that superior angle to the spine of the scapula to then lift that off to hook into your pincer grip. Okay, that's if it's fighting you. If it's not fighting you, you can just go on in, find the clavicle, pincer compress, lift, and go through your gliding pincer grip, which looks as so.
And it's something you want to do slowly.
Yes, this is an absolute art. If this is done right, you are going to go very slow. You can do it, like I said, multiple different ways. You're going to go slow. You can utilize cross fiber friction to coax that tissue to unroll. And what you're going to feel is that anterior side is going to curl underneath your fingers. You'll feel it roll. I'm curling my fingertips in now to then drive this through as I slowly get this to unroll. I will usually pick 3 different spots. I'll go as lateral as I can go to get it to elevate. I'll go right in the middle, and then we're going to focus immediately lateral to the spine here, which is more of kind of a pain to actually get to work.
Is this supraspinatus fossa? Is that the superior portion of the
Scapula.
Yes. So the spine and scapula is right here, where this little mountain ridge is. If you put your fingers on that, slightly anterior, and then hook in and down, you're in the supraspinous fossa until you go all the way lateral. You'll feel the acromion and the clavicle meet at the AC joint. And then supraspinatus dives deep to that, to over here. We'll worry about that later, but yes, that is the area we're talking about. We're getting it trapezius to lift off of that in this with this gliding pincer grip as we go. Pressure-wise, the more less you get where you're at. Cool.
So this is trap and supraspinatus work, or mostly just trap?
This is getting trap. This is trap work here, so that we can access those structures underneath.
Okay.
And you're gonna glide. And again, we're utilizing a money clip to coax it to unroll, and also pulling inferiorly on the skin to coax your line straight through. And after each one of these, I'm gonna hit it with a nice open palm draw to get this shoulder to remember to come down, because that's the goal of this. Usually on the lateral side, I'll switch to this grip that you guys have been seeing me do so that I can pincer between both fingers and hands, because this might slip out from underneath your fingers because it gets pretty tight out here. Middle part, you should be able to really grip, compress, draw inferiorly. But again, this part takes practice. And you isolate little trigger points. You can stop and treat them, like this one right here. You know, when you get to that mild discomfort. Perfect. Go ahead and take 3 or 4 good deep breaths for me. And I'm going to cross fiber friction. It'll feel like cross fiber your fingers, but technically it's actually linear. You're going with the direction of the muscle. But we see how we're barely moving. You can also do circular friction. And on those exhales, that's when you're gently gonna allow.
Are you using some fingertip movement in your left hand?
No, I'm
That's
mainly
just
doing
pincing?
the fingertip with my
You're pinching
right,
on there?
so that this has a structure. We're kind of pushing in like this,
Yeah.
and I'm just working that to get it to release. You can also just grip, strip, circular friction, but again, this hand might tax out if you're doing all
Yeah.
that with this hand. And then you do that about 8 to 12 times. When trigger points are discovered, just go ahead and bring them mild discomfort like we just did. That's step 3, using a money clip. And then as the trapezius starts to relax, we're going to close it out with 3 to 4 rounds of petricide, which is exactly what we have been doing, but we're just going to continue to lift and pull. The other thing that the trap really responds well to is if you pinch that, let's say this is a little bit tighter and it's sticking down, pinch into the muscle with a pincer grip, pull away, and superior. If you alternate that between lateral and superior movement, you will work yourself through that deep stripping line. Now, the hardest part is getting this most immediate surface right there next to the spine to lift up. So you've got to find where that is. Okay, so there's the border of the trap. Here's its clavicle attachment. All under here is not attached to the clavicle. You got to get underneath that. Okay, so now when I curl my fingers, you see this, you're gonna work your way, shift your angle. I just can't get it with my hand. Shift your angle, find the spinous process with one finger, gently go immediately lateral, and then immediately start compressing in and move superior towards the crane, towards the skull. And then once you isolate that, now this is this most superior portion of the trap. You can linear friction and strip laterally to get that to release. That will take some patience, so just be kind to yourself and to your partners today when you're practicing that. But then we'll hit it with some petrissage, and then we will move on in to number, we've already done number 5, move into number 6. Actually, let's do a little switcheroo here. We are actually going to do, where is our elevator? Okay, we're gonna go down to number 9 to move it up. Oh, or number 8 technically. So you can reposition yourself either crossbody or directly above the client's head. The reason for this is because this flows really nice. So we've already done a petrissage. We've got trapezius to loosen up a little bit. So I'm either gonna come right here or right here, depending on body mechanics and area. You can either sit or stand to do this. I usually stand. So what I'm gonna do is I'm gonna hook right into the side of the neck, because we know that the spinous processes, number one, we can't touch. Number two, we can palpate right here. Number three, number four, as far down as the levator goes. Then we got 5, 6, 7. Okay, so I'm gonna hold the hair up, hook in, and we're gonna direct our force gently towards the neck and those transverse processes. But then as we strip our line, we're gonna track all the way down levator towards that superior angle of the scapula right here. It's a really short line. You make contact with that superior angle, and I'm usually gonna stop and do a little bit of friction on each pass to kind of trace where that levator scapula is at and where that inferior angle is, so I know exactly where it is. And then you're gonna repeat. And I usually will do a little bit of cross fiber friction as we go, moving very slow. The other cool thing, if you wanna get fancy, there's two of them. So right now I'm on the most immediately lateral portion of the superior angle. I'm gently gonna lighten up to cross that and then sink right into the supraspinous fossa. This is literally gonna be our treatment for supraspinatus. This and a couple other little tricks. So you can do the same thing all in one nice, big, pretty line. And you'll go as far out as to where you start feeling the convergence of the spine of the scapula, the acromion, and the clavicle. But the other fancy thing is if you hook yourself in to the table, then you're gonna hook into the muscle, take the blade of your hand, push it into that spine of the scapula, and we'll depress, and we will work this as we strip this muscle. So you're lengthening under compression. And the other thing where people kind of go a little bit wrong, you can use the first rib as a pinning mechanism, but you should not really dig deep into that because it can get a little bit uncomfortable. And we got to keep in mind, our first rib is right there, right there. So you can feel that. So on your line, just make sure as you approach it, if it feels like bone, just gently cross fiber friction. Make sure you get a good bead on where that muscle is and that you're following the muscle's line and that you're not coming forward along that line of that first rib.
Could you go to the superior portion of the levator? And
Superior portion,
I just want to see how posterior it is.
it's kind of lateral because transverse processes go like this. So we've got spinous and transverse.
Okay.
So it is
Okay.
It's
lateral.
like,
right
so
here.
it's like the middle of the neck.
Pretty much, yeah.
Okay.
So that's why I'm hooking like this, following that line,
Yeah.
and coming down
Okay.
like so into that spine, or the spine of the scapula, not the actual spine itself. Now, then we have D 6 to 8 times an entire levator, starting with surface attachments, blah 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 blah. Before we move on, we are then going to go back up to deep stripping the middle belly. So I will usually treat this. You can go ahead and do your friction now by taking 2 thumbs on either side of that spine of the scapula, or excuse me, superior angle, and I'm very slowly going to do cross fiber friction on this attachment. You can also do linear, but again, our movements are going to be very small. But, and then if you find a little spot, you can hold it, depress that scapula, and that's why hooking into the table can be so effective. But even just from that, usually what I will do to close out before I move to the mid is I'll hold that hair again, take my thenar eminence immediately lateral to the spine just to give it some open palm effleurage all the way out that line. And you can see just rushing through this, we already have this level lower than the one on the right, which it was up here when we started. Okay, so now moving to the mid track. There's still a lot of things that we stole or that we use from your TR index. Both sides. There's actually a little pad on that. I'll do here. So I'm just gonna go ahead and put some lotion on. Open palm F-Garage. This is literally just from your TR written day. And then we are going to go into deep stripping 6 to 8 times along the most along the interscapular space piece here. Now how I will do this is I will hook one thumb into that superior angle. I'll take the other, shift so that I'm good and straight. This will do the, I'll do the T again. So I'm stripping these muscles across from one another and moving the bundles as we see fit. And again, you can honestly, some people you can just take 2 fingers and compress in like so to treat the trigger points or those tight bands. But the goal is to work much slower than you would in TRM and a lot more intent. We're also going to get, let's see how I just lost that trap head there. Snoop. So that's my line. Just like with the roll where I went like this and like this, we're going here and here with force. Now the other cool thing that you can do is if your client can take a good amount of pressure and you want to give your hands some relaxation, you can go ahead and get in your little squat, take your elbow, flat compress with your olecranon and the blunt part of your forearm, and then work your way internally and externally rotating your arm to coax that tissue through your deep stripping, or to coax your elbow through your deep stripping line. And then once you're off, you're gonna lighten up and just broad F-Garage, hit it with some open palm, just to pass on through. You need an increase in pressure, flex your elbow, because it'll shift that olecranon directly into it. Cross fiber friction with it too. Extend if you need less, but you need broad flat pressure just to go through these lines. You still doing okay pressure-wise? Are you sure?
Yeah.
Oh, okay. That sounded very
That was a timid
kind
ass.
of timid.
I'm just
Now,
losing. I'm sleepy.
you were what?
I'm just like checking out.
Oh, okay, you're fine. Now, the one that you need to be careful with is the most immediately lateral to the spine. So I would usually isolate, pull a little bit laterally, and I'm gonna take this hand to guide me all the way down, okay? So right into that side, take your olecranon, curl, rest your arm over here so that you can control it with your opposite elbow.
Are you talking about like the origins of it? Is that what you're trying to get at?
Or the, no, well, yeah, no, because the origin's on that nuchal line.
Okay.
So we're going immediately lateral to the spine itself. So this is about as close as you're gonna get. And if you go ahead and prep and practice for this, you're gonna be ahead on our splenius day. But again, when it comes time to shift, just kind of lunge, use your whole body to isolate those tender spots, and then just hold. Coach your client through the breath just like you would with anything else. And the other thing to tell them is, Brooke, I want you to breathe right into my elbow. So this way you can feel the ribcage expand. That's another reason why I like to leave.
You sink in more when she exhales.
No, we're just like a hydraulic piston. We're keeping it exactly that same amount of pressure because that ribcage expanding will increase it for us. Then to exit, do some circular friction. Come back off of that, and then I'm just going to go through the broad palm and immediately lateral that spine again. Okay. Alright. Now, the other thing I forgot is if you go and you look at the bottom part on the back side, if levator is resistant to lengthening during deep stripping, a contract relax exercise may be performed with static compression of trigger points. So let's say we hadn't got any alleviation of this at all, and it was fighting us. We're gonna need to hook in for this. I'm gonna compress in a levator. Let me know when it gets about mild. Okay. Now you're gonna take this hand, and what I want you to do, Brooke, is I want you to gently elevate your scapula into my hand. As soon as you feel the levator start contracting, I'm gonna have you hold. Then you're gonna have them hold. 3 to 6 good deep breaths, just like we would any other contract relax. On your third exhale, I want you to completely relax your shoulder for me. So we'll start one on this next one. Bring in one, and gently frictioning on the exhales. That's 2. And on your next exhale, you're gonna relax your shoulder for me. You're gonna take your hand again. We're gonna draw the shoulder down when she exhales. And exhale. And then just hold. Let it get adjusted to that. Hit it with some firm open palm. And that's just a really nice contract relax exercise you can do. And we got a little bit more off of that too. Cool. And that's pretty much it. Okay, it's just a lot more intent than you're going to use during the open palm moves of Swedish. Now, we got to flip over, but hang tight for me. So reposition supine, bolster on the knees, yada yada yada.
I have a quick question.
Shoot it.
So since the rhomboids insert
Oh, thank you.
on the medial side, should you put any pressure on the medial side of the scapula?
Medial side of the scapula. Through here, no hand friction, which is what I was about to scoop over. The other thing, when you're doing the rolling, because we forget about this nuchal line, and over top of the scapula, do one hand on either side and roll down so you get that elevation of that fascia away from the nuchal line to make sure, because we often forget those attachment sites through here. But kind of what Rachel was highlighting on this medial border, you can come through and friction with the direction of the muscle tissue, or cross fiber, because we know that they run like this. You can cross fiber friction all the way down if you want to be good thorough for the rhomboids. Now, for the rhomboid portion, we're obviously treating them a little bit as we do the middle trap because we're working through as well. But if the goal is to get these to activate, what I want you to do, Brooke, is when I depotement through here, I want you to activate what I'm tapping on, okay? And see how this is starting to draw back, and you can activate it a little bit more. There you go. And see how this is lifting? That's what we want. And then relax. The second you get it to activate, go ahead and have it relax. And then we're gonna repeat it. Right where I'm tapping. Right, there you go. And then hold. And then relax.
So you're strengthening.
I am, no, we're
Retraining.
educating this
Educating.
muscle that it needs to fire, and that this being elevated and back is where we want it.
Educating.
Educated.
Yeah.
Now, but that's really all I'm gonna do for rhomboids, because the majority of the time I need this to retract and come back. Move into the trap portion, or the levator portion on the anterior side. Go ahead and slide on down and look on your back for me. It doesn't matter what you roll. Put too much emphasis on that. Just turn over. We're gonna pull this down just to the top of those AC joints here in the front. Make sure we get good. And straight. This is where some of the magic for the neck happens. Now we were working on the left, so we're going to be turning to the right, okay? So, first things first, before we do anything, I'm just going to go ahead and hit this with some traction to start, okay? So move the hair out of the way. Open palm, scoop underneath. You may have to press into the table. Oh, I'm sorry, I probably pulled your hair.
No, you're good.
You're gonna have to press into the table, draw it down to where you meet the top of their shoulders. Get your first grip there. So I'm gripping here, and then my other hand is directly on the suboccipital ridge of the spine. If you just squeeze your hands and lean away, you will traction that entire cervical spine.
Is it kind of like the effleurage we're taught a little, but you just hold it?
Exactly.
Okay.
I'm really bad at that. I don't know why. Their head just goes everywhere. So this is what I do, which is traction. And they can breathe, and on an exhale, again, you can tilt that chin just a little bit as you draw their head back. On an exhale, we're then going to decrease the contraction in our hands first, because this is what makes this feel great. You gently let your hands go first, and then allow your arms to move forward. And it will generally stay close to where we're at. Okay. Now for this, we are then going to rotate the head to the right side. And I'm gonna grip underneath into these suboccipitals to make sure that we pivot exactly as we should to see where our range of motion is. So I'm gonna take you, let me know if you get any tension or restriction. You're gently
Little
just
tension.
right there, through here.
Mhm.
I'm gonna take a little bit of lotion. And what I'm gonna do is on those same lines that we've already done for the levator, we're gonna go from that superior angle along the spine all the way up. This that you're seeing right here is trapezius, so I need to make sure that we get lotion over top of it because we're gonna push that backwards to do these deep stripping lines. Do this a couple of different ways. You can scoop all the way underneath, bring your thumb up to that suboccipital ridge, firmly strip, taking this hand, move the trap posteriorly, so you slide in front of it. Now I'm on transverse process, right there. And it does not take a lot of pressure. Follow that line directly through. There we go. Straight lines, see how we're moving the trapezius posteriorly. Then you're gonna shift your angle just a touch towards the table, more 45 degree, so that that maintains the trapezius in a posterior position. We're sinking underneath it. There is the superior angle of the scapula. You really wanna get fancy here. Take your other hand, cross arm, depress that scapula. Maintain your pressure, and then relax it, compress, relax, compress, and this will friction those attachment sides. Now on a return, we're gonna cheat a little bit more. So instead of just lifting my thumb coming back up to here, I'm already in a good position with where my hand is at, so I'm gonna scoop underneath to hit that trap again. Friction by pronation, supination to coax right towards those transverse processes. When you get right here, take your finger, gently move trap out of the way. We're gonna come back up. Transverse processes, gentle but firm circular friction. Moving one cervical vertebrae at a time.
You can feel the transverse process.
Oh yeah.
Wow.
And then once you get to the occipital ridge, you can just kind of hook in and tilt that chin forward and down. And you can repeat that process, okay? Or to really friction at the end, you want to toss this in. I have started treating this way just because my hands have been getting a little bit tired. I'm gonna take my hand, I'm gonna scoop underneath the neck, pull that trap down, slide my hand underneath where you can feel it on the opposite side over here. And I'm gonna take my thumb, and we're gonna go superiorly all on each portion here of the trap, or not the trap, the levator's attachment. Firm, compression, going in a circle. You don't want to directly push one of these vertebrae laterally. You want to go around that transverse process. Feels like a little really firm, bony tic tac.
Is this gonna be impractical? Is this gonna be, this thing's terrifying to do.
No, it's not that bad. It's not that
I
bad.
hope I don't go this one.
Well, I also put SCM on there too, so that's another one people usually get freaked out about.
Is that the one where you displace?
No, that's longest capus coli. And again, we're frictioning all the way up. And this is how I've started treating occipitals, which you don't have to worry about today, but I'm gripping, you can see just underneath the chin. I'm not squeezing into the side of the neck, I'm just getting it to hold so that when I straighten my wrist, you're gonna traction and stretch. You can even take your finger, compress into that zone, and this will give you a good stretch too. Then, are you feeling stretching all right now?
A little bit.
A little bit, okay. So they're not feeling a great one. Hook into that superior angle. Take your forearm, depress that AC joint posteriorly. Open your palm up. And then you'll get a nice little stretch. And then take some good deep breaths for me. And then on the third breath, we're gently gonna relax. The first thing I'm gonna do is I'm gonna allow the head to come back into a neutral position. And then I'm going to track all the way back down this line here, just for some additional re-education that, hey, this needs to stay down and back. Slide back to the front, or to the top of the table. Reposition the head. Now you wanna make sure you're moving this for your client, and that they're not going like this, because they will. You can either go right into traction to close out, or if you wanna get super fancy again, scoop underneath, get that whole head, compress in to those transverse processes, and then we're gonna just gently take that spine through some lateral movement as we coax it into flexion. And then return to neutral. Before we go any further, we're gonna slide underneath. Now this feels really good. So slide all the way underneath. I'm below the scapula right now, curling my fingers up. And what I'm doing is, if this catches your fingers, don't worry about this, just do the pull, but I'm doing a wave motion as I come up to separate those tissues, kind of petrissage them a little bit.
When you say below, you mean inferior?
Inferior, sorry. You can stop if you feel some stuff that you might have missed, do some little circular friction to it. Continue to move all the way up. You're gonna follow that line from the trap, holding laterally, to then work your way to that occipital ridge into more traction. Now not the only way, but really, well, really kind of is the only way I can do this section anymore, is then I will go back and I will repeat that on both sides. So you take your hands, it's maybe tough with this sheet. I'm going to press down into the table to slide underneath. Now, if I curl my hands, I can lift that whole thoracic spine into extension. And you're gently gonna do that same thing all the way up.
And you went to just inferior of the scapula?
Yeah.
And you're doing that movement side by side. You're not doing it at the same time.
My hands are doing the same thing in
Okay.
synchronicity. Yeah.
Cool.
Then when I get to that superior angle, circular friction, and then we're gently going to work our way all the way back up. Traction on that suboccipital ridge. Relax down. And then if in that movement, sometimes they'll internally rotate again, just gently compress down over top, and then traction those shoulders inferiorly. And then relax. And you're done. The other thing that I will do on that pull is then I always close out my sessions having people take 3 slow breaths, and what I'm doing is I'm hooking into the occipitals, circular friction on the first exhale, the most firm traction I'm going to do on the cervical spine on the second exhale, and then I will do that depression movement at the very end to end with them where I want them. Voila.
Is there any danger areas that we got to be careful not to press on?
Good. Good. So, you take your fingers, rest into the scalene triangle right here. You will feel that pulse of the carotid. That's what you don't want to press on. So you want to stay lateral to that. You can treat the anterior scalene, but we'll show you guys how to do that with precision later. So don't worry about that now. You're going to be a little bit more lateral, almost immediately in the center of the lateral neck here, because that's where those little transverse processes are.
In this suboccipital there, are you using the weight of Hook's head, or are you giving more?
Well, I'm kind of barely lifting up, and then my lean back is what's really pulling, because we want that to stretch in there too.
Yeah.
But, and then that's how you close out. Now you guys have 45 minutes apiece to get this done. Before